Welcome to the Dr. Dad's podcast, where a naturopath and chiropractor come together each week to share lifestyle medicine, health advice, and inspiring interviews with some of the top experts in health and wellness, bringing you the latest in nutrition, exercise, ancient healing, toxins and detox, your microbiome, mindset, hormones, brain, and much more. Stay tuned. We're going to teach you how to experience growth daily.
What's up, everybody? Welcome back to another episode of the Dr. Dad's podcast. I'm here with none other than Dr. David Wardy. How are you, brother?
I'm good, brother. I miss you, man. I was thinking about that this week. I was like, I miss my friend. Like these travel restrictions, it's a bunch of BS, man. Like
crazy. I noticed you're wearing the Pachamama shirt.
Yeah, I was trying to represent. That was me missing you. See, you've been on my mind.
Well, Dave and I have matching shirts that we got at a retreat last year, and so I saw that, and I thought of the time we had together in Mexico, which is amazing. So, David, we got an amazing guest on today, and I'm going to read through his bio. And this guy, this guy's name is Dr. Tome Lowe, and he's an amazing researcher. I mean, his history is just so dense and so diversified. It's quite phenomenal. But a little bit about his family, because there's some interesting nuggets here. So. He's an amazing wife, married for 49 years, 11 children, one adopted, 2 with Downs. His oldest son, unfortunately, had a brain tumor, which unfortunately he passed about 3 years ago, and has been a massive amount of fuel for him in his inspiration and how he helps educate doctors all over the world. So he's going to be diving into information with us regarding ozone therapy and UBI, which is ultraviolet light blood irradiation. So he teaches physicians through Japan, Philippines, Ukraine, Mexico, Spain, US. His devices that he's patented and developed are in 16 countries, and they do over 50,000 treatments a year. I mean, this information that he's about to share with us, it may not be on the top of mind. You may or may not have heard of it before, but we do have some doctors listening into these calls as well. So Dr. Tome Lowe, thank you so much for being on the call here with us today.
Yeah, it's really good, and I'm here for you. That's kind of the point of it. Is if we can help your listeners, we can help people. I mean, isn't that what we're about? In God's world, it's here. What can we do to stop the fall, to help suffering, to give to others what we know? And I will correct you. I'm not a doctor. I am a businessman, and have had 16 different businesses through the years. And it's been a great privilege. This is my most favorite business. I was going to say favoritist, because it helps so many people. And it's been an eye-opener. And I do a lot of research, and I'm kind of like an engineer, entrepreneur, research, tinker. I was just messing around today and did one of the first UBI that I know of with a non-coherent LED light, which I'm feeling good. I play around with these things to see what can we do to make things better all the time. So thanks for inviting me, Nick and Dave. Good to have you, and just whatever I can do to supply your people with good information, let's do it.
Well, I mean, yeah, and thanks for the correction. I guess, I mean, your son, yeah, you're surrounded by family members, and some are doctors, and you're teaching and training doctors all over the world. You've made a huge impact in my own life, and I've just been watching you from afar. You run conferences or are part of the conferences of SOPMed. So what got you, I mean, you've got a long history, like you said, but what got you so inspired about ultraviolet light blood irradiation, that's a mouthful, and ozone therapy?
Yeah, it was, I was kind of in between businesses, if I can say it that way, when one kind of collapses or you're just not doing it anymore. And a guy in our church was an ICU nurse, and had spent years and years doing things. And he went on a mission trip, and they had UBI machine, one of the older ones there, but they had a patient come in who had rabies. And, if you've read up on rabies, it's pretty much fatal if you don't have the right medicines within the right amount of time. And so they said, yeah, go ahead, do your therapy, what they considered non-conventional medicine, because unfortunately, even on the mission field, a lot of doctors are conventional medicine people totally. And they just don't want to open the door to some of these things. But they let this guy do this, and miraculously he recovered. He did 2 treatments and went home within a week. They worked with tuberculosis down there. They worked with different cancers, non-healing wounds, and he came back all excited to our church and called me one day, and I know him, and he was starting to talk about this ultraviolet light, and I thought, oh, humor him, I'll listen. So I listened for about an hour. I thought, that's interesting, but I still didn't have a lot of impetus for it. And just as God's timing, I had another person call me from Florida, kind of about the same thing. It was actually the precursor for what they call the UV LRX, which is a fiber optic laser in the States. It's kind of gone up and down now, but I'll look into this. So I just spent the next 40 hours or so studying on UVI, and amazingly, there's almost nothing, how can I say it, nothing negative. It's a double negative. There's not anything written that's, knocking this thing down. Everything was positive. And so I thought, well, let's take a look at it. Matt, the guy I was working with, wanted to start a clinic. And I said, okay, let's take a look at it. So I went through all the parameters. We had a doctor oversight. And so I started and ran a clinic for a year just with UVI. That was it. That's all we did. Outpatient, walk in, $200, and we'll give you a treatment. And that was the off and running kind of moment. But I realized the machines weren't quite right. They weren't powerful enough, revamped that. But we probably had 500 people come through. Not a lot, not enough to make a living. But that's not what we were trying to do. And it was phenomenal. It was jaw-dropping. I mean, from tachycardia to, viral heart problems to rashes that hadn't gone away for 5 years to cancer people feeling better. And it was phenomenal. And so that got me started of really seeing what I can do. And it kind of launched from there of getting with guys like Robert Rohn and Frank Schallenberger and the ones that are out there that do a lot of ozone. And so they let me come in and teach on UBI. That was kind of my little niche. And I guess I still have that little niche, but now we've taught lots of doctors in both ozone and UBI, but I'm talking too much.
No, it's amazing. Well, can you explain the mechanism for people to understand? And why is there ultraviolet light getting into the blood? That's not completely non-natural, again, from the outside looking in, it's meant to hit the skin, not the blood. Can you tell us about the mechanism of what's actually happening?
Sure. It's kind of funny because last April 23rd, I think, Trump got on and he says, there's some way to put light inside the body, And then he had to use that dreadful word, or how about a disinfectant? I thought, oh,
he shot himself in the foot there, didn't he?
With the light. Yeah, it really did. And of course, it sent a flurry of stuff toward us too, but that's okay. The idea of light into the blood has been around for about 70, 80 years. It started with a guy named Emmett Knott, and he wanted to stop the sepsis, the blood poisoning, they called it back then, toxins in the blood, septic abortions. So women were dying, and they didn't have any antibiotics or anything. So he experimented way back in 1928 with making a device that would put UV light, because they know UV light killed bacteria and virus. They knew that much. He thought, well, maybe that'll kill bacteria and virus in the blood. And through a lot of experimenting on dogs, he finally realized I'm putting too much in, and he kind of honed it down. But that light going into the blood caused a whole raft of, we call it, an immune modulator. So your immune system's off if you have cold or flu or allergies or rheumatoid arthritis or all sorts of stuff, a sickness, a chronic illness. So your immune system is off. So if you can get something in there that is going to balance that immune system, that was what was happening. He didn't realize it back then. I mean, I've read tons of studies now on what kind of happens. I mean, it is things that happen. The red blood cells pick up the light, and that causes what they call membrane modification. It causes oxygen uptake. It causes ATP increase or energy increase. It causes red blood cells to be produced. So now we have a new supercharged red blood cell coming in. So there are a whole bunch of things that this energy packet that went into the red blood cell caused a positive, and it really didn't cause any ill effects. And that's the phenomenal thing, whether it's ozone or UVI. They're immune modulators, and I'll explain ozone later, but they also are so safe. And I'll talk about the range of that. That's why I'm experimenting a little bit more. I've got a great machine. I want to make it better. And so we're just saying, okay, what if we ramp this up? What if we use non-coherent light? What if you use colored light? And so some of those type of questions. But the studies are out there. I now have about 200 just on UVI. I've got another 100 and some on LBI, which is the sister therapy. It's just phenomenal. So,
and what does LBI stand for? Is that laser? Or
what's that? Yeah,
what
laser blood irradiation. So there's low-level laser radiation, which might be transdermal on the skin. This one is actually a fiber optic into the vein. Mm-hmm. So Russians have been doing that for about 30, 40 years. Mm-hmm. Yeah. So the consumer, I mean, a patient, if you're sick and medicines just haven't helped you, I mean, that's a hard thing for you guys, is you're dealing with the hardest of the hard, the toughest. They're coming in saying, fix me. Nothing else has worked. And that's where these tools are just super.
Well, I mean, in the culture that we live in, we're stuck indoors. I mean, we live in Canada, so there's a lot less vitamin D outside. The amount of actual typical UV exposure for most people, especially with the fear of skin cancer and, putting on all the topical remedies you can to block out the sun, it's not a surprise that we're stuck in a state of malillumination. I think of light as nutrition, and that's how I educate patients on it. And so if there's a way to upregulate your ability to get more light inside the body, it would make sense. And we know that the mitochondria are extremely photosensitive, and they do upregulate in the presence of light. So where else do we need to know about the technology, with regards to what are you doing? Are you drawing the blood out? Are we putting it through light? What can we talk about that?
Yeah, and it's so simple, and it's almost ashamedly simple in that we're just going to take 60 cc's of blood, what's that, half a cup or so, 3/4 cup of blood. And an anticoagulant is used with atyl heparin. And that blood is put into a bag of saline. Now we need some volume there, and I can explain all that, but we need about 220, 250 cc's total. But 2 or 3 minutes, it's a easy poke with a needle, draw out that blood, hook it up to a line, put the blood up into a bag. Now, if we've got ozone, we usually put that up, and then it drips back down through a special, we call it a cuvette, but it's a special quartz glass with a turbulator in it that allows maximum exposure. That's surrounded by 4 12-inch bulbs. There's UVA, UVB, UVC. Like I say, we're just looking at adding basically sunlight to that. Some add different colors, but as it goes by, it picks up that energy. Joules of energy go into the blood, and that goes into the patient. You don't feel most people don't feel anything. I've had some people say, boy, I can see better. My eyes are brighter. I don't know what's happening. I feel full of energy. I have others that say I'm a little tired, a little sleepy. Some say I'm flushed. But that's just the first initial reaction of what occurs, because this takes a day or two to really get your immune system changed to be what it should be. So, if your immune system's high, it's tacking. Your T cells are, your rheumatoid arthritis and lupus and, some of the other things that occur, even a shingles outbreak. I mean, anybody of you people out there got shingles? One treatment with this, pretty well slam dunk, dries it up in 2 or 3 days, and it's gone.
It's incredible.
Now, I'm sure the shingles shot people don't want to hear that. That's $1 billion industry, right? Per year. So I don't wave my flag real high. I'm kind of a low level. We're out here. We can't produce a medical device, although we do have a medical device, the same thing in Europe, CE marked medical. FDA is just tough to get through, and it's millions of dollars in years. So we haven't taken that route. So we've taken more of the, we make a UV purifier, and doctors buy it, and then we show them how to use it. But for patients, it's so easy, just that little bit of blood up in a bag, 30 minutes, sit in a comfortable chair with your arms sitting there. I don't care, read a book. And that's it, pull the needle out.
That's awesome. So, I mean, we do a lot of IV therapy in our clinic, and whether it be vitamin C, the amino acids, the NAD, is it possible to run any of these other nutrients through that bag, or do you want to keep it to saline?
Yeah, most of the time, some of them will hook up an IV right after that. Usually you want to run the UVI first, and some will do an IV after that. Probably don't want to do high vitamin C because we're putting an oxidant in there. And usually you're dealing with ozone too. So the high vitamin C people like Reardon Clinic and Ron Honeyhockey down there, they separate it by a couple hours, if they're doing that. Realize too that blood soaks up light so quickly that it's only 1% of the blood getting light. It's hard to imagine we take this light out, and people have talked about it and say, oh, the blood, it's all purified. No, it's not. Oh, it's just all treated by the light. No, it's not. We know the studies on it, but that small amount of light on that 1% of the blood that's in there is enough to cause the immune modulation. That also is kind of protective. So if you got something else rolling in your system, some other drug, 1%, who cares? Even if it's photosensitizing, it's 1% is so small. And that 1% that gets put in, that's the 1% of the 60 cc's that gets put into the 5 liters of blood in your body. So phenomenal results, small amount of light, really works well.
Can you speak a little bit about immune modulation, because maybe for some people they may not fully understand that concept. Sure. Just to lay a bit of groundwork. We think of people who are, in injury or acute inflammation, that might be an aspect of your helper cells called Th1. If you're stuck more in an autoimmune upregulation or chronic phase stress, that might be Th2. Are you speaking to that aspect, or if you can dive into that a little bit more, that'd be helpful.
Yeah, and I hate biochemistry. It's in a sense a weakness, and at the same time I go, it's okay, I can read some of this, I can study, I finally kind of catch the idea. So if it's lacking a little bit, I'll send you I have great manuals on it that deal with in depth. From a patient aspect, when you have something that's going on in your body and inflammation, occurs, you've got something that's out of whack, you've got a bacteria or virus, let's just take like the COVID, and may as well talk about it a little bit. You've got this virus roaming around, and it is causing issues in your body, and your immune system gets a little bit depressed, and the inflammation flares, and then you get in the lungs, an irritation, you get a pneumonia. All this is kind of occurring, and you go, what do we got for that? Now, antibiotics are great. Let's not kick them out of the place and say they don't work for virus, but, if you got a bacterial infection and you can do an antibiotic, I go, have at it, do it quick, easy, for the most part. Unless you've had a lot of it, it wrecks your gut biome too, which is part of the problem with that. But, for the consumer, if they realize when they've got this disease, you not only have the disease, you have the inflammation, and then you have toxins too. You have things that are piling up in your system that you can't get rid of very easily. And these toxins create other things in your body that cause issues, cause problems. And so this and this is real simple, but the immune modulation is that we're going to ramp up if you're low. Your immune system, it's going to cause it to see that there's something wrong and say, I need to get going. So that's part of what, and it's interesting, the energy of a light, just think of it as a little packet, Okay, so a packet goes into the red blood cells, right? Where is it that is really needed? Well, when you have inflammation and you have an infection, that's a energy sucking site, you know? So it wants like lots of glucose. Give me everything you can. Well, when you send in energy packets in there, they're not ready for this kind of an energy that comes in. And that's part of the idea of what, and it's theoretical, but part of the idea of what's destroying that infection then are these energy packets. It sucks up so much that it really, the body just takes over then and gets rid of it. Now on the other side where we've got autoimmune disorders, you know, which are pretty rampant too with all of the stuff out there, whether it's glyphosate or, you know, the things that are causing issues. You've got these T cells, you've got this attacking your system. What can we do to quiet that down? Now, they know that UBI works even for graft versus host disease, which is your body attacking, you know, some kind of a transplant you've had or something that's occurring. So what, again, the idea is the energy ramp up to the T cells causes a diminishing of the T cells. Therefore, your autoimmune disorders go down. Like I say, the shingles is you got the virus in you, you've got the antibodies, you get a immune compromise is what happens. And all of a sudden you get this rash flare up, you know, and that's shingles. UBI is, and I'm not sure why that one in particular, because there are times it doesn't work real well, but with the shingles, it just quiets it right down, 2 or 3 days. And really, if anybody's had shingles for a long time, you can get neuropathy, permanent neuropathy, and nerve damage from this rash. It's really dangerous. And I think, boy, just in that thing alone, if UBI was out there, it should be on every hospital floor, you know, for inflammation, infections, autoimmune disorders. I probably didn't answer it as well as you probably could, but
that was great. Yeah. So. David, go ahead, buddy.
I'm geeking out, man, because I've been using lasers for almost my entire career, and then I understand the power of light, you know, and at different frequency and spectrums. And I can imagine, I mean, like the way he describes it, you know, you put this light in, and where the inflammation is like an energy suck, right? Because I mean, that's what we're altering when we use this type of therapies, when we're using frequency-based therapy, which is what we're doing here.
Yeah.
And it's so powerful. Like, I want to get hooked up right now. Hook me up, buddy. Like, I mean, it's really exciting. And he's right. I mean, why is this not mainstream? Like, these should be in all the hospitals. Yeah. You know, we should be infusing people with light constantly to help them. Because like you're saying, like we have this big issue with we're not getting exposed enough, you know, to sunlight anymore. I mean, you go on and on, but this is an essential part of what we need as human beings. And all he's speaking into is like he's figured out a way to put this awesome delivery system to just get this dose in. And there's like no side effects, right? And you're just getting the benefits. Your body's healing.
Yeah. Yeah, it's not a silver bullet for everything, you know, and I wish it were. But you find out, and if people think I can come in, I mean, shingles is exception, but one treatment, I go, no, you really have to think 4 or 5 treatments of this. And you have to think 2 days apart, 3 days apart, let the body assimilate what you've got there, and then come after it again, kind of like domino. I'm going to keep piling in on this. And some people, you know, for really serious stuff like chronic EVB or something, you might need 10 of these treatments, and you may need to combine it with ozone. So, you know, there's a lot of things people read about on the internet, and we've tried to really get good videos out there so they realize that, because there's some very weak UBI machines out there. The Kastner unit from Germany has a little 6-inch, 6-inch UVA bulb. The Umatron unit has 2 6-inch UVC bulbs. They just weren't putting out the energy, and this is where, and I've done a lot of research with Emmett Knott and Miley and Christian, all these, you know, heroes of the past in a sense, and they really had a strong light source, UV light source, not just, you know, and the laser, the red lasers, they've got blue and green, and they've got some UV now too that they can actually work with. They all kind of have their place, and transdermally, some of these things have some really phenomenal effects, even down into the blood. There are some sublingual units, but we focused on getting more energy across the spectrum. So UV, let me explain, kind of like if you think of the light spectrum, okay? So we've got the visible light, we've got the reds down to the deep blues, and then we go past that blue into the UV, and it's called UVA. That's where we get our sunburn from, a little bit from UVB. But UVB doesn't make it down to the atmosphere very much. It's usually UVA. And then down past that, down to 257 nanometers. And again, if I had a chart, you could see it. But that's where we have the germicidal effects. So you'll hear people have UVC lights in their furnace. They got UVC lights in their water systems. They got UVC lights. They got a little pin you can take out camping. That's a little UVC, and you can stir it in water, and it'll kill the bacteria and virus. So that's the wavelength that does the dismantling, if you will, of the bacteria and virus. Now, and then you get UVB and UVA, and they all combine, along with especially the blue lights, are well absorbed with the blood. So that's the powerhouse of the UBI, which is ultraviolet blood radiation. Sometimes they call it biophotonic therapy. You might hear photophoresis is used, photoluminescence is used, some of those other terms that are out there. They're all referring to, I want to get light in the blood. And UV light in particular, but also some of the visible bands have positive effects.
Mm-hmm. Where do you think the world of like red light therapy, infrared, and some of those start to merge into this? And because you said that there's also different colored types of light therapy devices you can use for UBI.
Mm-hmm. Yeah, colored. It's interesting. The medical world has recognized for a long time that light is a therapeutic, or can be used as a therapeutic. Medical. So you go way back to 1903, and you got Nils Finsen, who's curing lupus vulgaris, this horrible rash on the face and so on, and like a 95% cure rate using light therapy, and he got the Nobel Prize for it. And then we skip all the way into the 1930s, almost, when Knott really started with some of his stuff with UV light. But when Matt was born, that's the son that passed away 3 years ago, he was jaundiced. So what do? They stick him in blue light because it breaks down the toxins in the bile. That's not getting, the liver's not working quite right yet. So they put him in blue light, put little goggles on him, and that was more the incubator type. And now they have these nice little blue lights that wrap around the infant, the red light, phenomenal things with red light. You can go to Planet Fitness and stand in front of a red light, and it's supposed to, tighten up that skin. I did it a couple of times, but you had to do it a whole bunch of times. And I thought, I'm beyond help anyway, I don't think so. Red lights, I've got a beautiful little infrared red LED unit at home that puts out some really nice power. It's a friend of mine who makes these things. I've got a laser, that also puts light in much deeper, just about the size of a silver dollar. So that's pretty good. It's, I think, a 25 watt unit. So if you're using those, Dave, you kind of know there's so many different applications for muscles, for hips. I mean, I got a little bit of a bad hip, and I can put that red light on 10, 15 minutes, and I'm good for 2 weeks. The pain just it's gone. I've increased that blood flow into there. I've caused that activation of healing, calling for healing into that area. So the red lights they're the ones that are most, if I can say, popular. They're going to penetrate the farthest. The IR, the infrared's going to give you some heat if you want to get into that, and they penetrate fairly well. You get down into the blues, and they don't penetrate very well. So you've got another issue. Now, I can put it into blood, though. Blood absorbs, the maximum amount of photonic energy is absorbed at 420, which is a violet blue area. So putting that into UBI is really part of a positive thing too. But red light therapy, baseball caps for growing hair, skin issues. There's some blue light for skin issues. They're just all over the internet, and they're, you can get some very good professional, powerful ones. You got to know what you're doing. But, Dave, if you're using those, you start to learn and you go, wow, this is fantastic. I just know if I got a bad knee, I can put that on for 10, 15, 20 minutes, and I can pulse it if I want. I can have solid light, and it does wonders. So there was something called Willow Curve out quite a few years ago. Did you ever see that?
No.
It was a little plastic piece, and it had some little red lights on it, and they advertised that, hey, before you get knee surgery, do this first. It's like $600 or something. FDA has come down on them now because they're making claims. But it was a very, I would call, weak red light system, but it still had positive results. So there's a lot of stuff out there. Buyer beware.
Yeah. Well, the reason I wanted you to dive into that just because it sort of adds credibility that light therapy is not just about UBI. There's many different applications, like we mentioned, the laser, the LED lights. It goes back to a Nobel Prize in, you said 1903. I mean, so these therapeutics have been around for a long time. So when people are tuning in and maybe hearing this for the first time, this isn't like it just started, a decade ago even. So, I mean, where to go from here? I mean, a patient wants to, experience it, or a doctor does. I mean, you've got clinics all over, well, technically all over the world that are doing this type of therapy. And then I guess on that note, there's something more unique about the way that you've done the UBI that you maybe won't find at all the different clinics. So people maybe, what do they need to know when they're doing this type of therapy as far as quality of light goes? Yeah.
And that is a difficulty, because you're dealing with a whole bunch of different areas. You've got, and I'm just going to roll through, so I just pulled a slide up here. So you got viral infections, you have bacterial infections, there is the inflammation conditions. Of course, joint pain, and that can get into a number of different areas. You got circulatory conditions, autoimmune conditions, even some of the eye disorders have been, there's studies on this thing. How can that help that? Skin disorders, respiratory diseases. So there's like 160 areas. And this is part of the problem, is that it works on so many things and actually is beneficial for so many things. People go, it's too good to be true. Now, a few years ago, I got to visit with Michael Hamblin. He's the head of the photobiology department at the Wellman Center at Harvard Medical. So I went out to Boston, and son and I sat down and went through a number of things with Michael, who had just written a book, and he's since been a real advocate for us. I guess I just say that to say, there's a whole group of people out there, doctors, physicians, almost in every state. Some states, their state boards are so tough that they don't want to get involved with this because they can lose their license. But almost every state there are physicians. And I mean, I'll just give it, people want to know the info at sopmed.org, info at sopmed.org. If they wrote us and just asked, we usually send out a list of physicians. We don't put it on the internet because some physicians don't want to be out there that way. They don't need to be. They're good, they're booked. But this treatment, you do 2 of these treatments, 3 of these treatments, you'll know if it's going to help you or not. You'll know. With your chronic disorders that you've been suffering with for years, 3 of these treatments, 4 of these treatments, you'll just feel the difference of your body starting to take this energy and cause it to give that immune modulation and get rid of some inflammation. Like I say, it is phenomenal what it does. And at the same time, we got guys like Harvard people that say this is a great therapy. Our European unit, if they want to get a little more technical, the Ultralux UV, so Ultralux, Lux, UV.com is our CE certified model. And we have a number of videos they can watch and testimonials of doctors and people, and also the data from the studies. And Michael Hamblin, he wrote 20 years ago, 25 years ago, Robert Rowan, who is a friend and he's out in California, kind of the big ozone guru, wrote The Cure That Time Forgot. So The Cure That Time Forgot was UVI. And it was a lot of the studies that I've been working with now, from Miley and Knott and Christensen, and I'm trying to think of 3 or 4 of the others, but they're major players in the 30s, 40s, and 50s. And so they did all these hospital validated studies on thousands of patients and hundreds of different disorders, and it's all there. I mean, somebody's dying of sepsis, and they had if it was just starting sepsis, 98%.
Wow.
If it was severe and they were going downhill, 50%. If they were moribund, 1 foot in the grave, they were more like 27% cured. And you can't just throw that stuff out and say, oh, they didn't know what they were doing. And oh yeah, they did. They weren't dummies in the 40s and 50s. But in 1952, it got killed by the AMA. Mm-hmm. So there's a story in my book about that. I talked to Emmett Knott III. Actually, a good friend of mine talked to Emmett Knott II. They're out in Seattle, and we got more of the story. And then I dug up more things. I got a box from about 40 till about 1960. It was all the records of the American Blood Irradiation Society, all the letters back and forth between Rebick and Knott and these guys. And I haven't even gone through it all, but I've been through quite a bit of it. And you shake your head and think, why wasn't this accepted? Yeah. And I can tell you why. Pharmaceuticals came in big time. Yeah. I mean, 1950, the Salk vaccine came in. Wonderful, wonderful, good stuff. But because Emmett Knott and the people wouldn't bow to the AMA, basically, they wanted to buy them, and they put out a bogus study in 1952 that shot down UVI. And it'll be in my book that hopefully consumers can read too. But it's kind of sad. It's kind of like the Royal Rife story and Oxy, and these guys that really had brilliant, brilliant minds and just didn't meet up with the guidelines of big pharma and AMA. I mean, tobacco did.
Yeah.
Some tobacco industry funded AMA in the early years. I mean, smoke a Camel, Carlos won't give you a cough.
That's right. Yeah, the doctors were in all the commercials too, right?
Yeah.
I mean, isn't it crazy to think that, all of us, even myself, I catch myself sometimes going, but that was old science. It's not valid now. And it's funny how we've all kind of bought in that paradigm. If it's new, it's legitimate. If it's something that happened in the past, like there's a Nobel Prize that won on this stuff, it was well researched, well documented, but then it just sort of gets sloughed off as, oh, that's old. But looking at the track record of some of these things, I mean, even the ketogenic diet that's resurfacing, or fasting, and all the different tools that have been used, in hundreds of years past. And we just had Dr. Thomas Levy on a podcast not too long ago, and he's saying you can find the oral connection to cardiovascular disease. And David asked, like, how far back does this go? This is hundreds of years, but we discount a lot of these archived studies and things like that, and just sort of disregard them. David, go ahead.
And there's this big shift of the paradigm of people being stuck on new is better, but look at all the things that are coming forward in the natural health arena. Like we're kind of all shifting back to the basics, right? And so it's exciting for me to hear about this type of therapy. And you were saying earlier how in Russia this has been going on for like 70 years, right? Yeah. Me and Nick talk about these absolute truths and relative truths of medicine. And what our listeners need to hear, and people need to understand, is just because you haven't heard about it doesn't mean it's not going to work. And maybe it's going to be more therapeutic for you than the solutions that are being offered to you mainstream, and this isn't, I wish this wasn't outside of the box thinking, because it shouldn't be. Like, it's been used since, how far back was this being used already in hospitals and stuff for different things? And then it just, like you're saying, it just got forgotten.
Yeah.
You-
Well,
yeah,
that's right. We're grateful for people like you that are bringing this kind of information back out and, re-educating maybe the next generation of doctors that there's definitely a gap where a lot of this stuff was lost unless you had those great connections to some of the doctors that you mentioned or these Harvard researchers and whatnot now, which is just exciting for us to hear. I got to say that when you made that point for a patient to try something out and give it 3 to 4 times, and if it's working, you'll know. I mean, those are the kind of responses that both patients deserve to have and doctors deserve to deliver. I find myself oftentimes whether I don't often recommend a therapy unless there can be some sort of reference point for where you were to where you are, after just a short period of time or a short number of treatments. And that kind of feedback is so powerful for people to hear. So I'm glad that you brought that up.
Yeah, I think, we're there for patients, you're there for patients, and they have to get a little education on their own. 15 years ago, I just did what the guys in the white coats said. I walked in, if I had a problem, they tried to take care of it, and I'm fairly healthy anyway, so there wasn't that very often I go to a doctor. But when Mac got his tumors, that was a big push to say what's out there. And then the guy with the ICU nurse coming from Togo, West Africa, saying we ought to do this. It's kind of and you guys know this too. And just for listeners, you shouldn't just hand your health over to somebody and say just fix me. And especially give me a pill and fix me, because so often we're covering symptoms. And I sympathize for those that can't do research, but the internet's phenomenal. I mean, we can go out and do, just basic even research and listen to guys, whether it's Asprey or Mercola or Tom Levy or, you, and you can get this information on exactly the problem, that you've got, and see if there's something that's natural. I mean, this is just, I won't say putting light in blood is natural, but it doesn't have any side effects. So it's got to be really, really low level. And the same with ozone. It's people like ozone, the ozone layer, we're blocking the ultraviolet light, and that's true. But ozone is a powerful, powerful tool for many, many people. And there's many more people that do ozone. I think, let's see, Doctors Ozone, drsozone.com has a lot of good information. drsuvi.com is what I did probably 10 years ago, and I really need to revamp it. But when you're writing a book, you go, it can all wait,
That's right.
But consumers, boy, if you can't research, find a friend who can and say, would you look this up for me and just see, am I really hurting myself by doing this? Like I say, there's a place for antibiotics, that can really help. But there's so much of a place for chiropractic, and people miss out on that. I forget what population, is it 15% of the population, 20% that might use chiropractic?
I wish. It's like
10% maybe.
Oh man, yeah.
Well, you're down in El Paso too, right? So it might be different numbers down there as well.
So unfortunate. I think you guys are the nutrition specialists more than anybody. I think, much more than MDDO, because you guys get into that and you find out what people need. You find out where they're weak. Vitamin D. Everybody should be doing vitamin D. They should get their blood levels up 50 to 80, Magnesium, another big thing that's kind of coming out there, and seeing how the benefits are for that. And high vitamin C. That's for cancer. My brother-in-law, unfortunately, just passed away a month ago with stage 4 prostate cancer. He was 52.
Wow, he's young.
Now, 8 years ago, he found out he had bone mets. 8 years ago, stage 4. He's done everything in the alternative world, kind of, and it finally caught up to him. But he had 8 good years. I mean, ride motorcycle, speedboat, still keep working. And every summer he'd say, boy, I just hope I have one more good summer. And he'd have another good summer. 8 years, stage 4. And he just passed away. I mean, a guy went, hey, Todd had a really good life, but he was disciplined. He ate right. He exercised. He took what supplements, he did UBI, he did high vitamin C. I mean, he did all those things that you need to do to kick and put at bay. And Tom Levy's a great guy to, you know, reference. Did you see his COVID? Let me count the ways. Did you?
No, I haven't seen that one.
He put out. Oh my goodness! And he just lists out all the different ways that we can handle COVID now. Wow. Study after study, and just he must have had 15, 17 different things on there.
Well, he did share the hydrogen peroxide nebulizer, and actually, David, you used that on your mom, didn't you?
Yeah, she got sick, and man, like within 48 hours, she cleaned it up quick. She was like back to normal. Very powerful. Easy,
cheap, you know, inexpensive at-home things.
Yeah.
Now, UBI isn't. Ozone can be done at home. Nebulizing, hydrogen peroxide, great tool. These are all working with the oxygen singlets too. You know, so
can you speak about that a little bit more? Like you brought up the ozone. I think it'd be helpful for people to understand a little bit of that.
Yeah, and we're going to have another section on ozone. Totally. Realize ozone's kind of the big dog, and there's more written on ozone than UBI. But radical oxygen species is what you don't want a lot of in your system. So we take antioxidants. But high vitamin C and ozone, and even UBI a little bit, create that radical oxygen species. Now, what that's doing is you've got a sluggish, and I've got a chapter I wrote for ozone. I may put out an ozone book sometime. Maybe I'll do it with my son. He works more with ozone. But it's kind of a stress to the body. You know, like if you exercise and you hurt after you exercise, you go, well, that's a good thing. You know, I just tore a little bit of muscle. It's got to repair. But after it repairs, it's going to be a little bit stronger. And I keep doing that. Well, ozone is that slap to the system, you know, that says, come on, get going. Immune modulator again. So that oxidative stress. Now, let's break that down a little bit. Ozone is O3. O2 is oxygen, right? So O3 is ozone, and it's very reactive. H2O2, hydrogen peroxide, releases one of those oxygens. So we end up with water and that singlet again out there. So that's kind of the idea behind ozone. And high vitamin C does the same type of thing. We're creating an oxidative situation. Well, you could almost call it a pro-oxidator, and it's going to call for antioxidant because it's saying, hey, you got a problem in here, send in the antioxidants. Come on, let's clean this thing up. So high vitamin C, hydrogen peroxide, ozone, and a little bit, although UBI has some different things, it does create a little reactive oxygen species also. So stressing your body sometimes a little bit, regulated, low stress, is a good thing. Chronic stress, and you can get chronic oxidative stress too, and you give them ozone, they don't feel good. It just doesn't help. We are over oxidating them at that point. So you might get 20% of your ozone patients that they say, I feel terrible. 2 days, it's just a Herxheimer. Well, maybe not. Maybe you're oxidatively stressed, and we shouldn't have done that. So, and hopefully that helps people. So these very natural things of water, H2O, oxygen, O2, and then send that spark of lightning through a thunderstorm. What do you get? A little bit of ozone, that fresh smell. Ozone kills bacteria and virus, kind of like the UV light. So I've got a little generator at home, and my wife uses it all the time. You throw it, you get vegetables, even if they're organic, she throws it in there and lets it bubble through for 7 minutes. It kills on the surface any bacteria or virus, and it will dismantle 95% of the pesticides. Wow. And these are just little bubbler units, $100, or so. You can get them online. So, there's so many good things out there to realize. I hit a skunk on my car. I hadn't done it for years. Pull the car in the garage and go, move it out, I get an ozone generator. It's about this half the size of a shoebox. I turn it on. I let it run overnight. Runs 2 or 3 hours. Skunk smell's gone. It dismantles it. It takes smoke smell out. I mean, ozone's a whole nother world, but just fun things that we can have at our disposal. UVI a little bit tougher.
So the ozone, I mean, just for people who they still don't get an ozone machine and start plugging their nasal passageways into the one.
Yeah.
So let's talk about some of the, with things you shouldn't do with ozone.
Well, ozone's very reactive, and it will react with things like latex and rubber. Even with some of the metals, it'll react. So when you're creating ozone, you have to watch out for if it's going to react with anything. But more so is ozone is a reactive gas that if you breathe it into the lungs, that's where you have the problem, because we don't have enough of the PUFAs, the fatty acids and so on, to absorb it, and so irritate the lung lining, and you'll be coughing. Now, I can work in a certain level of ozone. It's I think it's 0.01 time weight average of ozone parts per million. I forget what it is, but when it gets to an upper level, it's going to irritate your lungs. Therefore, FDA says ozone is a toxic gas with no known medical usage. No, we only have 2,000 studies. There are only 38 international medical organizations doing it. There's about 50,000 ozone specialists around the world using it each day. Okay, but FDA has called it a toxic gas, which if I sat and breathed it, we've messed with this, so we know. Mm-hmm. I've been coughing before really bad. Time out. Let's open the windows, get the fans going. Because we experimented with ozone equipment and different things to see what's out there and how it works. And so, but really, just that mild irritant, you can't stand to be in ozone that is going to be at a toxic level. You can't stand it. I mean, you're coughing and you're going to get out. You're going to open a window, you're going to turn the ozone generator off. And as a doctor, you control it. It's all contained. We have destruct units that'll get rid of it. But the little bit like it's about a 3 gamma of the vegetable cleaner. Just mm-hmm. smell it a little bit. Not going to hurt you. Mm-hmm. That's low level ozone. The one you crank and get rid of smoke smell and so on, the skunk smell. That one you pretty well have to turn it on and leave. Right. In a closed room. And then after it quits, it's on a timer. And then you open it up and it's fine. Smoke smell in a car works great. Wow. Get rid of that. You buy a car, and here in Michigan, you think it's winter, smells fine. You get a humid day in the summer, you go, a smoker. But you can throw an ozone generator in, let it run for 2 hours. It dismantles the smoke. It doesn't just cover it; it takes it apart, so you don't have that smoke smell.
Wow. Well, I know I've done what's it called, auricular. So through the ears, I've done some ozone, and it was interesting because I noticed all this bubbling and actually clearing of my sinus passageways after. I think I was at a conference, and so I was about 3-hour time difference, and I think my immune system was getting a little bit of a hit. But people also do rectal ozone, right?
Yeah, almost any cavity we can kind of look
any orifice.
So any orifice, yeah. So let's talk about that next time. I know our time's kind of getting people, and there's so much to talk about on ozone. And just let me leave with a little bit of encouragement. Hey, if someone out there is sick, see Dr. Nick, see Dr. Dave here, and they'll have their areas to help. If they can get into this UBI sometime, that would be a great thing. If not, we know people out there that can help you. So, you're going to have to spend some money. This is out-of-pocket pay. There's no insurance that covers this. But what's your health worth? And you go, okay, I'm going to scrounge together. I had a lady that they actually spent a whole bunch more than they needed to, but he was chronic EBV. I mean, he was to the point where he was in bed. His arm wasn't working. He couldn't hardly speak. I mean, it was really nasty. He's young. He's like 38. And so she did the search, and she found UBI and ozone, and it took about 15 treatments, but he's totally restored. came back from just a, disability. I mean, he could not work anymore. So these things have a lot of power. They can do something for you. They actually went across country and spent like 20 grand doing this. If they would have known about me, and she's a friend now, called me and we've talked a lot, but it's like, yeah, you could have done this for about $1,500 right back home.
Wow.
Maybe 2 grand at most, and you wouldn't have to be cross country. But the doctor had advertised that she's a specialist in this, and yeah, she's a ozone and UVI. So yeah, chronic disorders, have at it. I would be doing this in a heartbeat, and it's never going to hurt you. And any way which we can help, and we'll have another session on ozone, so stay tuned for that, and we'll go through a little bit of the history and all the things that does and how it works, and we'll get into the joint injections and the things like that too. The ears, awesome. The sinuses, the rectal, yeah.
Name it. More to come.
More to come.
More explorations to come. So just before we sign off, where can people find more about you? If you can just list off some of those websites again.
Sure.
And show notes as well. And then we always leave our listeners with a little home play assignment, something they can do on their own at home. What's your favorite thing for people to get started with?
Okay. Give you the websites, the DRS Doctors, UBI.com. That's Umbrella Boy India, UBI.com. Has a lot of good stuff on it. A lot of testimonials and studies. Doctors Ozone, DRS Ozone.com, has a lot on ozone, and you can go there. A little more technical, ultraluxuv.com, our medical device in Europe. So it's designed that way. You'll see that, ultraluxuv.com. Home owners, if I was sick, and I've done lots of these, don't worry. I would say look into rectal ozone. Simply03.com has a lot of good information. And again, they're going to play like I do is, I don't sell a medical device. We just sell ozone generators. But those other 2 sites give you all the information. That's where they can look and just learn. Just go after it. But rectal ozone's easy to do. I've talked with Sylvia Menendez, head of the Cuban Ozone Authority, and they don't have money. So what have they done? Hundreds of studies on 10,000s of people with just rectal ozone with phenomenal results.
Wow.
Everything from retinitis pigmentosa, which is tunnel vision. And, you can arrest it. You can keep it from going any farther, to infections, to all sorts of maladies and problems that people have just with rectal ozone. So I know it sounds terrible, but
there's worse things like keeping an infection. There's lots of worse things than doing.
Yeah, there's really a lot of things. They do vaginal insufflations. They do rectal insufflations, ear insufflations, nasal. You want to clear your sinuses up of infection. Nasal insufflation. That's a little more tricky. We'll talk about that next time.
Yeah, I look forward to it. Thank you so much, Tom. This is amazing. You're such an amazing resource of information, and we learned a ton.
Good.
Really grateful to have you on.
Thank you,
we're
Tom.
glad to do it. Get that out there, see what happens. All right.
We'll see you on the next one.
Guys. Yep.
Bye.
Thanks for listening. If you enjoyed today's podcast, please be sure to subscribe to the Dr. Dads and share with your family and friends. You can also follow and interact with Dr. Nick and Dr. David on Facebook and Instagram for a daily dose of inspiration and the latest in health and wellness. Be well.